I'm Dr. Vernon Williams. I was born in Trinidad in the West Indies, Trinidad and Tobago, the original Robinson Crusoe Island. When I was 10, I met my parents for the first time. They moved me to New York City. I lived in Harlem in the South Bronx. I went to Albert Einstein Medical School and Harvard University undergraduate. Then I did general surgery in Pittsburgh, Pennsylvania, joined the Air Force, became a flight surgeon, moved to San Antonio, where I currently reside. I did emergency medicine for about 26 years before I joined the A4M. And at the A4M, I learned a lot about metabolic, regenerative, and functional medicine. And that's what I do now. I do preventive medicine and I do aesthetic medicine. You know, I tell everyone I'm 29, but I was born in '57. And I can tell you this much, I am a lot younger than I used to be. I had a pituitary adenoma in 1994, and as a result of the pituitary adenoma, which was a prolactinoma, my breast cup was a D cup, and I gained 55 pounds. And once I got that corrected, I started learning a lot more about preventive medicine and about hormone optimization. And as a result, I take care of myself the way I take care of my patients. I have something called a 5-step program. With the 5-step program, initially, if someone comes in and the population is overweight in general, I offer someone a pure lipo, which is a procedure where we actually take some of the fat from their body and we sculpt their body. And then right after we finish doing that, I put them through a week of detox. And with the detox, they'll lose about 8 to 10 pounds with the detox, but you remove a lot of the impurities, a lot of chemicals from the body with the detox. And then after that week, we put them on a weight loss program. And with the weight loss program, my patients generally lose about 15 to 20 pounds in the first month with that. But you know, you still cannot get the effects you want without optimizing people's hormones. You know, for instance, if a patient comes to me and I check their thyroid, you know, you have hypothyroid and hyperthyroidism. You know, they're two different extremes, all right? Someone who may be down here, they go see the doctor and the doctor says your levels are normal. But the patient says, you know, but doctor, I feel cold, I feel run down, I feel tired, I look at food, I gain weight. Or someone who's up here who is hyperthyroid, they would be the kinds who run around, have a lot of energy, their metabolism is incredible, and they're the ones who people say, you know, I don't know where you put that horse that you just ate, but you don't seem to gain any weight at all. Well, I take the patient from here and I bring them up to here, and by doing that, I increase their metabolism, I increase their energy level, the patient can now eat better, the patient feels so much better. And that's what I do. I optimize all the hormones because the hormones is a symphony. 75% of my patients are women, 25% are men. Even the men also have some problems because, you know, men, once you get 35 or so, you start suffering from a male menopause, which means that you are having the same symptoms women have as in menopause, except that women, they drop off the cliff and you know that they're in menopause. Men, their symptoms are gradual. They gradual decline, and over the years, they finally realize, you know something, I'm not the way I used to be. I'm gaining some belly fat, I don't have the energy, I just don't do the things I want to do. And when I optimize the men, the first thing their wife says, well, he's doing so many things he never used to do before. You know, he's no longer on the couch all the time. He's now wants to do things with me. He starts doing the things that he used to do when he's younger. He doesn't even realize it. His life is better. His energy is better. And that's what I really like. I optimize the body internally, but I also do aesthetic procedures, laser procedures like laser face, laser hair. We do facial rejuvenation. We do all the facial procedures, Botox, we do radius, we do all of those things with the patient. So we make you look good inside and then we make you look good on the outside. I have two practices. In San Antonio, we have the Wellness Aesthetic Medical Center, which is my preventive medicine metabolic practice along with the aesthetic practice. In Houston, I have the Urban Retreat, which is a day spa that features hair, nails, skin care, feet. In addition to that, it has my aesthetic practice there and my 5-step program.